Oh my gosh, I think beauty means to me feeling good, feeling happy within yourself. And it doesn't necessarily have to be anything physical. I just think it needs to be something that the person has to own and feeling confident in their own skin.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Fabi Cano, owner of Gemini Glow Med Spa, who has over 11 years of experience in neuro and neurosurgery. So Fabi, welcome and glad to have you here.
Hi, thank you so much for having me.
Yeah, so Fabi, let's start with this. How did you first get interested in the medical field?
Yes, it all started many, many years ago. I had a brother who was born with cerebral palsy, and we immigrated from Mexico. So I saw how my mom struggled with the language and just like not connecting, with or not being able to communicate, I should say, with the nursing staff and the doctors. And at the time I was like 14. So I decided I might go into the healthcare field, but I wasn't sure because I was only 14 at the time. So I decided to kind of think about it and put it in the back pocket. And then as I grew up, I just became more and more interested. And I wanted to help the community, especially those who didn't spoke the language. And so that's kind of how I got interested into the healthcare field.
Okay. And then what led you to transitioning more into the aesthetic side of medicine?
Yeah, that's a really good question. When I was a little girl, I used to get bullied a lot just because I am petite, I'm small. And I think it all started with me just thinking about, I want to look better. I want to feel better about myself. And initially it was more like plastic surgery. I think I'm going to get this done and that done to look better and feel better about myself. And I think that's how it all started with me. So like I started getting treatments like facials and microneedling. And I thought, you know what, I think I want to do this and help others feel good about themselves too.
Okay. And so what led you up to you deciding to start your own practice? I mean, why not just work for another practice or work for the hospital or something like that?
I love that question because actually it was a bad experience that led me into opening my own med spa. As a nurse practitioner, well, I still work. I just want to mention I do work still full time at the hospital. So I still work for the neurosurgery team here in Salt Lake City. And for the last 3 years, I've been practicing aesthetics. I did work for 2 different spots before I opened my own. And the first one was great. The second one, the experience was not the greatest experience with the owner being not medical. It was a little tough and I went through a really hard situation with them. And so that led me to think, you know what, I can do this on my own. So then that kind of pushed me over the edge, which I'm really grateful for.
Got it. Okay. So now that you have your own practice, what are some of the most common treatments that your clients come to you for?
Yeah, I would want to say the number one treatment is going to be weight loss. I feel like weight loss is kind of on the top right now all throughout the US. The second treatment would be probably Botox, and then third being lip fillers.
Got it. Okay. Now I want to dive a little bit deeper into the weight loss side. Are you doing like the GLP-1s, all those types?
Yeah, those are the most common GLP-1s.
Okay, got it. So now when it comes to the GLP-1s, I've heard a lot of kind of mixed things about it. I've heard for some people it's really, really good. I've also heard people say that just for general health, it's good, but also if you are underweight, you shouldn't do it just for general health. So can you kind of help dispel some of the like, when is it really a good time or in what situations would it be good to use GLP-1s?
Yes, that is a really good question. So really GLP-1s are, it's a diabetic medication, first of all, and it is also approved for people with a BMI over 27, being a little overweight, and a comorbidity. So meaning they are over 27 BMI and they have some type of comorbidity like blood pressure, prediabetes, fatty liver, things like that, like high cholesterol. Or the other indication would be if anybody is over the BMI of 30. And yes, you're right. There's a lot of people out there that are underweight, and I don't know that I would say it's good for in general health. But I think it's more for those who really do need it. As I mentioned, diabetes or really overweight.
Got it. Okay. Now, when it comes to taking GLP-1s, is it something that once they lose the weight, do they need to stay on it for the rest of their lives, or how does that work?
Lots of people ask that question. And you know what? One of the things in my practice, I try to do is teach my patients how to also change their lifestyle, meaning they have to start exercising, start eating healthy. Even though I don't have like a nutritionist or a dietitian per se, I do try to go over some of the healthy foods. And I always recommend, when they start, we talk about that. So changing lifestyle habits so that they can keep it up even after they lose their weight, because we don't want people to stay on the medication forever. Mm-hmm. We want people to have, be able to choose the correct food and exercise and stay active.
Okay. And so when it comes to the lifestyle, like the food they eat or whatever they drink, I think for the most part, people kind of know like, oh, fast food is bad, soda is bad. But what are some other, I guess, maybe surprising foods that you would kind of recommend to them to either avoid or to eat as part of this new lifestyle change?
Sure. One of the things that I recommend is making sure that they have plenty of water throughout the day, so 2 to 3 liters a day or 8 glasses of water. The other thing I always recommend is a lot of people know the Mediterranean diet here in the US, which is the plate with the 3 portions, your protein, your vegetables, your carbs. And usually I go over picking the right protein. So lean meat, which is usually like your chicken, fish, salmon, turkey. And then some of the things I do tell them to avoid is fried food, fast food like fries, hamburgers. And I think it's just a matter of educating them and going with them along the journey of their weight loss. And you'll be surprised after how long people learn so much about the foods they're eating. Because when we talk about carbs, I think people think of like, tortilla, for example. I'm from Mexico, tortilla or bread or pasta. And I say, yes, those are all correct. But you also have to think about some vegetables also have carbohydrates, and we have to be educating them in which ones and the amounts, which could be very different for every person.
Mm-hmm. Okay. So you talked about some of the foods and making sure that you're hydrated. What about drinks? Like if someone wants to have more than just water every single day for the rest of their lives, what are some drinks that they can drink, or what are some drinks that they should absolutely avoid?
Yeah, I mean, we all want a little flavor in our drinks, right? So I always suggest things like Gatorade with no sugar, anything that's not sugar added. And the other thing is, I wouldn't say I tell my patients not to drink soda. I say everything with a limit. They need to watch what they're drinking. Even me, I mean, there's days when I'm like, you can have 1 glass of wine. There's some studies out there that says 1 glass of wine is good, so just limiting themselves to what they're drinking with sugary drinks. But I wouldn't say, I say, no, never drink soda, and of course, avoid alcohol. We all want to avoid alcohol, but yeah.
Got it. Now, with the GLP-1s, there was this term that was floating around called Ozempic Face. I think it's kind of when they take it and it hollows out the fat pads in their face so they look like a skeleton. How can people avoid Ozempic Face, or is it only for certain people, or does it happen to everyone? Like, can you just kind of talk a little bit more about what Ozempic Face is and like how do you avoid it?
Yeah. You know what? For the longest time, people, even colleagues of mine, would come to me and say, "But what about the Ozempic Face?" And I don't know if I was just being blind or I just wasn't doing it long enough. I've been doing this for almost 3 years now, and I keep asking like, "What do you mean the Ozempic Face?" Like, I don't know that I've seen it, but now I understand. And I think, after people have lost so much weight, And where you're used to seeing this person that's overweight with a more chubby face, all of a sudden they look so sunken. And I do want to say that some people who didn't need the weight loss and lost weight to the point where they look like they were sunken and they look sick. I think that's kind of what the Ozempic face people are referring to. So one of the ways, I mean, like I said, I don't think I've seen it in any of my clients, but I would say that one of the ways you want to avoid that is making sure that you're identifying with your patient when is a good time for them to stop the medication. And also the second thing is, I feel like a lot of people, while they're on the GLP-1, they expect to not be hungry at all, or that they don't need to eat. And that is another part of the education that we have to do, and always encourage that we do not want to take their hunger away. We want to be able to control their hunger so that they pick the right food, and then always encourage protein throughout the day. And I think that's a good way to avoid the Ozempic face.
Okay, got it. Now, also from my understanding of when you take something like Ozempic or any of the GLP-1s, resistance training, so working out with weights, is important to help retain the muscle. Is that true, or can you kind of get away without doing resistance training and just take the GLP-1 and then that's it? Or like, what's your recommendation when it comes specifically to the working out portion of it?
Yes, I actually, one of the things I recommend is resistance training, especially women who are really scared. Male, no problem. You can tell them to work out, lift weights, and they're happy to do it because they want to gain that muscle. As women, I think there is that misconception that if you lift, you're going to get bulky and heavy. And I always give myself as an example because I've always liked to work out since I was in my 20s. And I always say, oh my gosh, there's no way you're going to gain that muscle that you think you're going to get buff and tough and look like a male. I give that example of me. I've been doing this for this long. And even when I'm trying to like gain so much muscle, it's really hard for a woman to gain that much muscle, right? Where they look masculine. So I always try to make some education there. And we know that there are studies that says that if you have more muscle, your insulin becomes more sensitive. So those people with insulin resistance, which a lot of people think that's diabetes, that is not diabetes. Insulin resistance just means you have a higher level of insulin in your blood that is not being efficient. And so that can lead to diabetes. But we know that if you have muscle, your insulin becomes more sensitive, and that will help with weight loss. It will help with preventing diabetes as well. So yes, definitely always recommend strength training.
Okay, got it. Now, I also want to dive a little bit deeper into the quality of GLP-1s. Is that something that consumers should kind of be concerned about as far as checking to make sure the quality, I'm going to call it the quality of product is okay? Or is that generally not something they need to worry about?
Oh my gosh, definitely. They need to worry about it. It's just like any other medication. There are side effects. They need to worry about where the medication is coming from, who is providing the medication, because nowadays we see so many crazy things out there, people doing, bringing medications from who knows where. And so, yes, that definitely they need to make sure they are doing their weight loss and getting their medication from a licensed provider.
Okay. Now, with around GLP-1s, I know there's a lot of misconceptions, a lot of myths surrounding it. So could you share a few of those myths or misconceptions that you've heard most often, the most common ones from your clients?
From the GLP-1s, yeah, definitely. One of them is that your body becomes addicted to it. I don't think it's not an addictive medication. We know that. It doesn't actually your body becomes a little bit more like tolerant to it because you don't react the same. And that is why there is a titration dose. We start slow, we go up. What would be another misconception? I feel like the other misconception is that they will have a rebound once they are off the medication. I don't think it's necessarily that once you're off, I mean, that is a factor that you're going to rebound, but that's what we use the medication as a little push, and not just the medication, like only the medication to help you lose weight, but we want to do, like I mentioned, all the other lifestyle changes. I think those are kind of the main ones that I hear about. I can't think of any others.
Okay. Now, let's say that someone does want to get on GLP-1s. They've heard about it, they've looked it up, and then they're ready to move forward. And they now are looking for someone, a provider who can help them throughout this journey. What would be the most important piece of advice you would give to this person as they're doing this search? Like what to keep an eye out for, that can make sure that the provider is good and is able to get them the end result. And also on the flip side of that, what should they keep an eye out to avoid?
Right. I think making sure that they know that this is an actual licensed provider. Let's see. So, I mean, one of the ways to verify would be by looking up their license. That is, we know that that's public in the state of Utah. It's called DUPL. This is where you can find, you can search by name and find if they have a license. I'm not sure if that's the same in other states. And then I think making sure that they're getting that general assessment when they go see a provider for the first time, because it's just like going to the doctor. It's not just something that can happen like that without getting a medical history. So I think people need to be making sure that they're getting the correct assessment as far as like having their blood work checked to see if they have any problems with their liver, their kidney, getting a baseline exam of what their overall health looks like, which is something I like to do, is checking to see if they have diabetes, insulin resistance. Do we know what your thyroid is doing? Because are you gaining weight because of your thyroid? Is there another reason why you're also gaining weight that we need to target and not just giving you the medication just like that?
Okay. So the license is important. Making sure that they run you through a good consultation to make sure that they understand the issues you're going through. What about on the flip side of that? Like things to avoid, like what's kind of a red flag that if people see this, then it's like, maybe you should keep searching?
Yeah, I think one of the things I've heard, and I've heard this from different states, if you go somewhere and it's a hairdresser giving you the medication, oh my gosh, run away from there. But just making sure that the place looks legit
So not doing
and
it
that there is a
backyard.
license for it. Yeah, don't do it in someone's home. Don't just let anybody ingest you just because they tell you they do this. Make sure that they are licensed.
Got it. Okay. Now, I'm curious, what role do you believe creativity plays in how you approach your patient care? Because I think not a lot of people think about creativity when it comes to medical treatments, but everyone's also very individual as well. So, what role do you think creativity plays?
It plays a big role. Actually, and if we stay in the GLP-1 treatment, it is so individualized that you have to be creative when it comes to seeing how each of your patients respond. And each of your patients is a little bit different. I mean, we see these people once a week. I've seen people for over a year, and you get to know them pretty close, kind of what their daily habits are like. Do they exercise? What do they eat? Do they have a dog they can walk? Little things like that. Like I try to be creative with this specific client that I can think of right now, but he tells me, "Oh, Fabi, I don't do anything. All I do is sit at home in my couch all day long." And I say, "Do you have a dog?" "Yes, I have a dog." "Can you take the dog out for a walk? Can you do instead of doing 30 minutes a day, which sounds like a lot of walking, can you do 3 walks of 10 minutes?" So you kind of have to get creative. Can you eat, for example, let's say they have their 3-food plate. Can you start with your vegetables and your protein? So by the time you get to your carbohydrates, you're almost full and you don't eat all of your carbohydrates. Little things like that do make a difference.
So it's the small things that add up.
Yes, definitely.
Got it. Okay. Now, I'm sure that Fabi, throughout your experience, you've had some memorable stories that come to mind. Is there maybe one story that you can share of one that was just a memorable case or a challenging case or a tough case, and how you were able to get them a great outcome in the end?
Yes, I can think of one. Actually, this is the same client I was just talking about that tells me he's always sitting in the couch. When he found me at the beginning of the year, actually. So he's been with me for 1 year now. he came to me because he wanted to get started on testosterone. And he said, you know what, my friends, and he's a tall guy, overweight, back pain, doesn't really do much. And he said, my friend told me he got on testosterone and he feels great. And I just want to get testosterone. How did you find me? Oh, I found you on Google. Okay, well, let's start with an assessment. And then we go over like, when was the last time you had a physical exam? Anyways, we did labs, we did an exam. He came back being diabetic. And so diabetic, high cholesterol, low testosterone, which obesity goes with low testosterone too. I don't know if males know this, but the bigger you are, the lower your testosterone is too. So I did an overall assessment and I said, okay, here's my plan. This is what we're going to do. We're going to start you on the weight loss. We can also start you on because I also do hormone replacement. We can start you on the hormone replacement and do the two together. He was not thinking about doing the weight loss with me, but I knew he needed the weight loss. Just his BMI was over 40, so he was morbidly obese. You know, the first 3-4 months was a little rough. We didn't see barely any changes. Like the weight loss was so slow. I thought he was gonna leave. And every time I saw him every week, I would give him little small advices and I would praise him every time I saw something different or when he told me he got up and moved around a little bit. And anyways, it was tough. I thought he was gonna leave. And then 8 months later, we go in and repeat his labs. And he went from being diabetic 7.4 on his A1C to literally 5.4, which is not even pre-diabetic. And his mood changed. His mood got so much better. He was in a better mood. His energy changed. And just the fact that he has lost so far about 80 pounds, you know, so his overall health is now much better. Wow. And that just, it makes me feel, you know, happy when I see results like this.
No, it's incredible. I mean, that he had the fortitude to stick with it, even though he didn't see results necessarily in the beginning. I think because a lot of people have that. It's like, oh, I get on GLP-1s, I'm going to drop the weight, it's just going to melt off my body and it'll be fine. But he stuck with it. And then when you focus on the health long term, you're going to get the results long term. So I think that's fantastic.
Exactly.
Now, Fabi, where do you think the future of aesthetics, of wellness is going?
You know what? I think, and I'm seeing more of the wellness actually. I think wellness is moving away from just the you know, the old medicine. I don't know, do they call that Western medicine? You know, to more wellness, where people are now trying to you know, stay more healthy, exercise. We're hearing more about peptides. I don't use a ton of peptides. We know GLP-1s are peptides, but there are a bunch of other peptides that people are using to, you know, for anti-aging, to lose fat, to get more muscle, to get more energy, more vitamins, you know, vitamin injections, vitamin IV infusions. And so I think this new generation is moving forward towards being more healthy and preventing instead of just treating the illness.
Got it. And for your practice, Gemini Glow Med Spa, what's your vision for your practice?
Oh, I just see myself. So like I mentioned earlier, I'm working in the hospital full time. I see myself moving slowly into just full-time aesthetics, not just aesthetics, but I love doing the wellness part. And that's my other focus. I have a nurse who, because, you know, we can all be good at doing, you know, lots of things, but sometimes you have to focus on one thing if you want to get better at it. So I do have a nurse who is focusing more on the aesthetics part, even though I still like to stay very active in the aesthetics. I'm trying to focus more on the wellness part, which is, like I mentioned, the vitamins, the preventing illness, the exercise, the peptides, the hormone replacement type of thing. So I'm just excited for us to keep growing in the industry. We've only been open for a little over a year, about a year and a half.
Okay, well, that's amazing. So, Fabi, I have one last question for you, but before I ask it, I do want to point people to your website at geminiglowut.com. Now, last question for you. What does beauty mean to you?
Oh my gosh, I think beauty means to me feeling good, feeling happy within yourself, And it doesn't necessarily have to be anything physical. I just think it needs to be something that the person has to own and feeling confident in their own skin.
Well, there you have it. Fabi sharing her expertise. So Fabi, where can people contact you in your practice?
Yes, that, like I mentioned, our website, GeminiGlowUT.com, or we do have a phone number, 801-839-5075.
Awesome. Well, Fabi, this is great. Thank you for coming on, and thank you for sharing your message.
Thank you. Thanks for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.